Yeah, so the panel that I moderated was on looking at new ways to modify the immune system. So, in my field, in the autoimmune and inflammatory diseases, we have made tremendous progress in the treatment of patients. And mostly that's been with monoclonal antibody therapy. And what we've done is we've taken the effector cytokines and we've blocked them. And it's been incredibly effective. But when you stop those medications, the disease comes back because what you're doing is blocking an inflammation loop. So the idea here is to think about ways in which we can actually modify the immune system and use some of the pathways that are already in existence and modify them to treat these diseases. And so the panel talked about checkpoint inhibition in cancer. In our diseases, what we want to do is augment the checkpoint. And there's evidence that that can be useful. There's a phase 2 in rheumatoid arthritis where that's been done. And also the use of cellular therapies. So CAR T cells in our diseases, specifically a CD19 CAR T has been used in lupus. And then T regulatory cells and the ways in which those T regs could be used to alter our disease, the disease mechanisms, basically. There have been many insights that I got from the panel. One of them is that there are off-the-shelf T cells that are specific for viruses. And our patients are immunosuppressed and they're susceptible to these viruses. Those T cells can be used to treat an infection, but they can also be used preventatively. So should we be thinking about doing that when we start a patient on a certain immunosuppressive agent that might cause reactivation of a virus or the JC virus? That's one thing. And then the other thing is the use of Tregs in treating our diseases. There's a lot of potential here, and it's very early days. And there are lots of challenges and potential pitfalls, but I think that approach is tremendously exciting. I think it's incredibly important to bring these people together. We should all be thinking about how we can advance the science and how we can advance the treatment of our patients. And we need industry, we need financing, and we need scientists to come together. And a lot of what I got out of the panel was actually the science behind what these companies are doing. And just to hear about this cutting edge work, I think is so important for everyone in finance as well. So it's a brilliant idea to bring everyone together, and just a wonderful conference. I mean, I think MGB has investigators in all aspects of human disease. So you can always find an expert on everything at MGB, and people are very innovative. I mean, I think we're really thinking about being at the cutting edge, moving the fields forward, and those are the types of people that you want at a conference like this, to be able to talk with investors and financial people, to think about where they should be placing their funding.